All right, we're going to get started. So welcome, everybody. Thank you so much for coming today. Welcome to our supporters, volunteers, donors, network partners, staff, and more as we recap the past year, give updates on our goals, and answer your questions. If you have any questions you would like to ask Elizabeth, please enter those questions in the Q&A box at the bottom of your screen. It's my absolute honor to introduce Elizabeth McCarthy, President and CEO of the Community Food Bank of New Jersey. Elizabeth joined CFB&J as President and CEO in July 2023, bringing a wealth of experience and a deep commitment to addressing food insecurity. With a strong background in nonprofit leadership, Elizabeth has been instrumental in guiding CFB&J's strategic direction, fostering innovative solutions, and driving impactful programs. Her passion for supporting underserved communities has quickly made her a vital leader in our mission to address food security in the Garden State. Take it away, Elizabeth.
Thank you so much, Megan, and thank you everyone for joining us. It was just about a year ago that I did my first webinar here. It's really just been an incredible year working at CFB&J, getting to know so many of all of you. I've put a lot of miles on my car in that year, traveling around the state, but really wanted to make sure that I visited many partners from the most urban to the most rural and everything in between, really looking at, getting to meet some of our neighbors, spending time with those partners, really hearing from people what was important to them. So it's really just been a great year, have seen some amazing programs in action, particularly excited by some of the partnerships I see that our partners building with health providers, with nutrition education, really sort of trying to make sure that we and our network are all advancing the way that we provide food to people. So it's not just food. Obviously, food's incredibly important, but all of the things that go with that. I'll be talking today about some of the strategic initiatives that we introduced last year. We had 6, and we'll go through some of them in a little bit. But I thought it would be helpful. We never know exactly who's going to join these webinars, so making sure to give a bit of an overview of the work that we do. Most of you are probably very familiar with at least some of our work. Presumably that's why you joined, but want to give people a sense of both our sort of immediate hunger relief work, as well as some of our longer term work. So we'll start with the immediate hunger relief. Most people know us for food distribution. Obviously, that is a huge part of what we do. It's to pantries, it's to soup kitchens. As you'll see right below that, it's child feeding programs. We do have over 800 partners throughout our 11 counties of New Jersey. And, we are very proud of the fact that we can distribute over 100 million pounds of food. Unfortunately, the need in New Jersey is going up, not down. That's true across the country. It is definitely part of a trend. It is sometimes surprising to people since unemployment is so low and the economy is doing better. But we've all seen, prices have gone up, wages have not always kept pace. And that the recovery from COVID is still ongoing. For a lot of people, that was such a financially devastating time that it really will take a while for people to fully recover. We've also increased our college pantries and our senior programs, really looking for kind of those different populations and how hunger impacts different groups differently. So there is no one size fits all in food distribution. We know that, our partners know that. So really looking for innovative ways to serve different populations. College students and seniors are 2 of the fastest growing groups of food insecure people. So really finding ways to meet them and their unique needs. It may mean, some college students, it might mean they only have a microwave, they don't have a full kitchen, kind of very sort of getting on the grassroots level and figuring out what different populations need. And then crisis response work, which people aren't always aware that we do. We've recently, we were geared up for the storms in Louisiana to be able to help people down there. More locally, in August, there were storms in Newark that caused flooding and power outages. People had to be moved to shelters. We provided the hot meals for people, those families that had to be moved to shelters. So we're always ready to respond for short-term emergency food insecurity as well. So some of you may not be quite as familiar with our longer term work. So much of what we do now is really trying to get to long-lasting impact. What does that mean? It can mean health programs. So we have programs for people with diabetes or heart disease, making sure that they have the nutritional education that they need, as well as then the specific foods and recipes and access to that food, right? When we talk about food insecurity, it does not just mean that somebody has some food to fill the hunger of that moment. It means that they have continuous access to healthy and nutritious food. SNAP enrollment, this is huge. We are very fortunate in New Jersey that our SNAP levels, this is for anyone who doesn't know what used to be called food stamps, that we have a higher level, but a lot of people don't know about it or don't know that they're eligible. So we are going out into communities, we and some of our partners, we do this, with many other nonprofit providers, doing work in the community, really coming to people where they are with our mobile unit or going into other organizations and helping people with that paperwork. Not everyone has the high literacy level or speaks English, and they really need assistance to be able to get those SNAP enrollments up and give them more consistent way to acquire food. Nutrition education, again, that ties to the health issues, but also for child development, just making sure that people understand what food is necessary for themselves and their families. It can mean that they miss less work, less school, really just looking at the health benefits of food. And workforce development, a lot of people know we've long had a culinary training program. We now also have a workforce training program, warehouse training program. So people learning to use pallet jacks and forklifts and really very employable jobs in the state of New Jersey at the moment. And then our period and diaper programs. So, we all know those are very expensive products and really can impact people. And they can't use some of the government benefits to get those products. So making sure that people have access to those for the health benefits and for the economic benefits. So I will go through kind of some of our strategic priority areas. We did talk about these last year, and we've talked about them along the way. Mostly the top three are the ones that I'll talk about today, since the bottom three are a little more internal, but I will touch on those. So new and better distribution, healthy and nourishing food, and improving and serving. New and better distribution has been a huge part of our work for this year. So we really want to be a reliable partner to our partner agencies, that they know when we are coming, that they know, that their orders will be right, that we are doing distribution in a good way. Many people have heard me say that if you were to develop a food distribution system, you probably would not have it look like what ours looks like today. And that's not a criticism of anyone. That's true of every food bank. They kind of rise up organically when a community or a religious group or really just people and members of a community see a need and want to fill it. And so pantries have come up over time, but it means that we have a network of some very tiny pantries that are getting very small deliveries, some very large ones that have to get frequent deliveries. Complicated by the fact that now that we are doing so much more produce and protein, there has to be refrigeration, there has to be proper storage, et cetera. So we've really been trying to ask a lot of questions of our network and saying, how are we doing? We also now have better data, which we can actually tell people how we are doing in terms of we have better software for our trucks and our warehouse and making sure that we're able to answer those. But we did want to look at our network. And luckily, there's so much more data, and we've been using some mapping to really start to get a sense of what our partners look like, how things are distributed, and what food insecurity looks like in New Jersey. So we started with the food insecurity data and really started to look at where is it the most severe. The areas that don't have any coloring are not our service area. So it's not to imply that there's not food insecurity there, but this is just for the parts that the Community Food Bank of New Jersey covers. You can see it in broad strokes, but what we do with that then is really zoom in on those communities and try to see, we can go, zip code by zip code, even smaller in some cases, to look at exactly where food insecurity is, and then look at our network and say, well, are we matching up to the areas with most severe need? So all of those dots represent different types of our partners. Obviously, the bigger dot means higher volume. And you can see, in a large part it matches up, but there are areas, even in that red zone up in the Northeast, you can see that we don't have as many partners. So we would zoom in on that, really say, is there a gap there? Is there something that we should be doing differently? Work that we've always done sort of anecdotally, but now really putting data towards it. and sort of looking at, over time, is 800 the right number of partners? Are there some partners that could be doing, could work together so that we're bringing one delivery to a community and it's serving several different partners? So really just getting started in a lot of that work, but it's very exciting. And I think as we do it, we're also going to look at our partners themselves and say, okay, if this is a place we think can do more, maybe there's a community that needs more. What do they need from us to help them do that? Do they need more refrigeration? Do they need a loading dock? Are there various things that we need to support our network with even more in the new and better distribution? But it is something that we've really been digging into, making sure we understand our partners and know who has that capacity and who can really do those things. So while we developed some of those statistics to sort of say how much are we on time, we also developed a report card that gives our partners an ability to tell us how we're doing. We'll have quarterly pulse surveys. We've been sort of phasing it in throughout the network. So if you're a partner on and you haven't gotten it yet, you will be getting it and giving us a chance for you to tell us, how are we doing? How are we meeting your needs? We started a partner collaboration council about a year ago with 32 members who meet with us quarterly, and they helped us develop that and kind of told us what are the most important things. Not surprisingly to anyone that's ever run an organization, it's always communication is the number one thing. I think people understand things happen. You can be late in a delivery. Are we able to communicate that to people in time? And our internal communication. I'll talk a little later about the data internally, but I know one frustration for partners sometimes is, one person in the food bank covers one thing, someone else covers something else. They don't seem to always talk to each other. We need to have our data sort of more aligned so that we are answering everything in one voice and that our internal communication will help our external communication. We've also held county by county listening sessions for our partners. They were incredibly helpful for me. We went through all the counties, but we're going to start over. That's going to be an ongoing thing. And so really just trying to hear firsthand from partners in that county, how things are going, areas that we could do better. One of the nice things is too, it's really helped some of those partners in that county get to know each other. So that's really important. The more that we sort of want people to work together, we're all serving a community together. We should all have the same goals and the same understanding of where we're headed. So that's been a really nice addition to all of that. So that's on serving the network. We'll just put up for 1 second again the strategic goals, just so we know. The next one that I was going to cover is healthy and nourishing food. So there's a lot of exciting things happening in this area. We all know that, the idea, again, as I said, is not just to serve people food, not the food bank of years ago where you would picture just canned food everywhere. Over 30% of what we supply at this point is fresh produce. Add to that all the fresh and frozen protein, and we really are getting to a point where, the vast majority of our food will be healthy, nutrient-dense food. We also, in order to work with that and to help our partners know about the different kinds of foods that we were offering, we developed a nutrition policy. Again, our Partner Collaboration Council, as well as some of our other partners, really helped us to say, what are the things that we should be looking for? Which foods are most nutrient dense? Which ones should we label choose often, choose sometimes, or choose rarely, to help our neighbors know which foods are good for them, as well as really kind of, designating if you're diabetic or if you have heart disease, these are foods to encourage versus foods to avoid. So that's been really exciting. And now, when our partners log in to order their food, they'll actually be able to see the designation of different foods that they get from the food bank. In addition to increase the produce that we're distributing, we've been working with local farmers through the local food purchase assistance. We have 30 partnerships with farms and other producers in the state to get as much local food as possible with socially disadvantaged farmers or producers. So it's really a good connection to get food from those farms directly to pantries. And as much as possible, we're trying, especially with produce, to have things never even have to enter our warehouse. The more food that we can have go directly to partners, it's fresher, it just makes more sense, and it saves kind of that time and that lack of efficiency of someone having to sort it and then redistribute it. So that's been really exciting, is just to see, and our partners have so much really encouraged, in their own pantries. I've gone to pantries and seen people are color coding certain foods. People are really sort of making sure, giving shopping lists to people who have certain health issues. So we've really seen some great innovations around this with our partners. So that's been very exciting. And then the last on that top row of strategic initiatives are advocacy. really looking to improve and serve what we're doing with the network and what we're doing with our government. We're so fortunate in New Jersey. We're the only state that has an Office of Food Security Advocate that really just shows the commitment of the governor, of the speaker to this issue. I mean, we've been very lucky that this has always been one of the issues that they've paid the most attention to. But we know that that can change over time as administrations change, et cetera. So really making sure that all of our elected officials understand. I think sometimes people think New Jersey is, known as a pretty wealthy state. Maybe there isn't as much food insecurity, but 1 in 9 people in New Jersey struggles with food insecurity. Many of our elected officials don't know that. It's an issue that was very much top of mind during the pandemic, but has sort of drifted from people's awareness. So we've really been working on making sure that we are meeting with elected officials, that we are backing policies that make sense, and some that aren't even, directly about food, that we just support and sort of encourage elected officials. There's been some about period products that are just so important for us all to be together in solving these issues. Another thing we heard from our network was that they want to get more involved in advocacy. So we have a conference every spring for our partners. There we had a session on advocacy, and it was the one that people said, we want more of that. So we've had webinars, and we're really trying to make sure that we're working with people to make sure that they know how to advocate with their elected officials or with their community officials, as well as helping their neighbors to do that. We've been doing some voter registration work. We are by no means someone who endorses specific candidates, but we do make sure people have education and know where to find out about the issues that affect them and know how to register to vote. We just think that's really important. We've also been trying to support our network more through grants. We distributed almost $4.5 million to the partners, pantries, et cetera, to do refrigeration, to do vehicles, to do lighting, really anything that builds their capacity to build neighbors. So building our network across the board is something that we are very committed to. The last strategic initiatives were, as I said, a little more internal, but we have our culture of caring, making sure that even though we are now a very large organization with over 300 employees, we don't lose what this started as, which was, by our founder, Kathleen DiChiara, started this as a place where she gave jobs to people that nobody else would give a job to. So we've really been looking into our reentry work, making sure that we're supporting people who are coming here, sometimes right out of jail or prison, and really needing that opportunity. So making sure that we do professional development, that people can see a career here. We're really proud that we have people who've put in decades working here, and want to make sure that we can encourage that and give people opportunities to grow. We've had staff get involved in courses at Essex Community College. We've had really just sort of lots of opportunities to make sure that we have the most skilled workforce that we can. And then data governance, which might sound like a boring topic to people, but we're very excited about it. Again, I think this is where I talk about how it will help our communication. Right now, when I'm going to visit partners, I talk to like our food sourcing team and our network relations team. And I say, give me the lay of the land. What programs does this partner do? What have any issues that have come up in? We don't have a database that brings that all into one place. But through the benefit of an anonymous donor, we have gotten started on that. We're going to be developing a CRM that will, make our communication internally and therefore externally so much better. So something that we really are very excited about it in the next year. I think we'll see some dramatic differences as we start to implement all of that. And then the data, as I mentioned earlier, the external data. So really looking at, sort of that mapping and all of those issues. And then last, many of you have been to our warehouse. You know that it is not necessarily the most modern building. It doesn't, I will say, I was talking to somebody yesterday who asked about we used to have a parking lot that flooded all the time. It hasn't flooded in quite some time, but we are in a floodplain. So it's something we always have to worry about. But also we just don't have enough refrigerator and freezer space. I mean, as the food distribution has changed, we have not been able to sort of do as much even as we would like of produce and protein and those things because our building is not equipped for it. So we have been working on a plan to examine this building, see if we can stay here but renovate, or if we have to find a new space. It is something we're looking at. As I mentioned, though, at the same time, I really think, honestly, the less food that enters here, the better. The more that we can do direct delivery to places for produce, for protein, it certainly makes food fresher, it gets there faster, and it will reduce the amount that we will have to renovate here. So that is something that we're looking at. And again, stay tuned, because at some point we will be doing something. But this building, considering how inefficient it is, our staff does an incredible job, but we could make their lives much easier by having it be a building that is actually sort of designed for this purpose. Um, so those are, our main strategic initiatives. As I said, it's just been an incredible year. Getting to meet so many of our partners has just been such a gift, and really just seeing the work that goes on in each community and how different it is. I think that's one of the things that's been so interesting to me, is every partner I go to has a different approach that's informed by their community, that's informed by, where their neighbors may come from, cultural differences. And so that's just been really fascinating. So I am excited to answer any questions people may have, or if there's areas that you want to hear more about, I'm happy to talk through those.
All right, we're going to get started with our Q&A here in just a moment. So, Elizabeth, we got some great questions here in the chat. So, first one, and personally one of my favorites, I think this is great. What are you most excited about? And conversely, what keeps you up at night?
I'm excited about so many of the partnerships that I see. I mean, a lot of people know we just opened a pantry in, I guess, June in Bergen County, kind of using some of that data we talked about. I mean, it predates me, but really looking at where there was a gap. And in Garfield, in Bergen County, there really wasn't a provider there. And so we opened a pantry, but the exciting thing about it is we'll be working, it's going to be the Unity Health Pantry. So we'll be co-located, or working with Greater Bergen, or working with Tracy Zur from Bergen County on sort of developing a multi-service site. So right now the pantry is open, but there will be mental health services. There will be health services. There is a early Head Start program right across the parking lot, a senior center right nearby, anywhere where we can sort of meet people where they are. So someone may come into the door with health issues, but in the term, as the provider is speaking with them, learns that really some of it's a nutrition issue. They can just come right across the parking lot, meet with our staff, understand, what's available for them, both in terms of food for right now, but benefits that they might be available for. So all those partnerships that I'm seeing out there, and that's one that we're very actively involved in, but many of our partners, the pantries and things, are developing their own models and relationships. And I think that's just wonderful and will really serve the community better. What keeps me up at night? Oh, so much. I guess, a lot of it is sort of the need, and just how dramatically it still has not only stayed high after COVID, but gone even higher. And I hear that when I talk to partners, just that there are so many more people. I've talked to neighbors who say, I never thought that I would be at a pantry. We see lots of working people who just can't make it to the next paycheck. And that's a scary situation, I think, especially when we see it in children, in seniors, and these very vulnerable populations who we can't meet all of their needs right now. And so really trying to get to some of those longer term solutions is the thing that I probably think the most about.
So speaking of those longer term solutions, we have a question here. Someone is asking if you can talk about the partnership and collaboration between the 5 New Jersey food banks.
Yeah, we work very closely together, which is honestly, for me coming in, that was something I didn't know to expect, that to have this group of colleagues, and it's been amazing. All of us work together. I mean, first of all, I don't think a week goes by that we don't all talk to each other, which is very important, but also work on real projects together. So we have a partnership that we're working on with Horizon that's called Growing Healthy Pantries. We have all come together to come up with, the nutritional guidelines that I talked about, show a toolkit to show people how to make their pantry a choice pantry, really a whole number of different ways that pantries can grow and change. And that's been a collaboration throughout the state that we will each pilot in our respective areas. It will look a little different in every place, as it should. We're not looking for kind of cookie cutter solutions. But so that's one really active way that we participate together. But again, if I had a question, especially not being someone who had worked in a food bank before, coming in, the CEOs of the other food banks have just been a wealth of knowledge for me and just a support system. And it's just been amazing. And then in concrete ways. So if somebody, has a power outage and needs a refrigerated truck, we're there to help each other. We are a lot larger than some of the others, so we do have a little more capacity. So have been asked to step in and help in many situations, which we always want to be able to do. So I think we all have the same goals for the state of New Jersey, and we really work very closely together to make sure that we're partnering in that, and not, there's nothing about it that feels like, a turf war or anything like that, which is just so nice for me coming in, knowing that this is a really supportive network.
So referencing some of those maps that you showed us earlier, so what data do we use to create those maps?
Oh, that is a great question. And we could give you a full list because it is so many different areas that we get it from. So some is from Feeding America, some is from the federal government, but then some of it is community level data, because in order for us to get to a point that we really understand food insecurity, we know that communities that have a larger percentage of people of color have more food insecurity. We know that places that have a large number of immigrants can have more food insecurity. So really looking at how all those different things affect communities. You can look at examples like two families who might have the same income. One's family of color, one's a white family. They usually have different access to wealth. Because of decisions that have been made, for years on racial injustice. So we know that in those communities, they're less likely to maybe have a support network that can help them financially. They're less likely to have savings, again, because of, policies that have taken place over time. But so we have to adjust the data. So it's not just looking at income in different communities and assuming that food insecurity goes right in line with that. So I think altogether, I'm going to get the number wrong, but it's at least 30 different data sets that we kind of pull together to go into that. But we get very excited about data. Not everyone does, but so whoever asked that question, if they want to get in touch with us about more of that, we'd be happy to discuss that in detail.
So sort of pivoting to some of our mobile units. We have two questions here. So we had one question asking about mobile units in Atlantic County. So our mobile pantries, but also how does the mobile unit for SNAP enrollment work?
Yeah, great question. So we do have those two different mobile units. We do have a mobile unit that works in Atlantic County and can certainly get people, route information and where our stops are. They change somewhat seasonally because the population down there changes seasonally. So some people who stay in hotels part of the time, we've worked with some hotels. I know when I went one day to volunteer, it was in Ventnor, we had a place, but we do move around. But you can get that information on our website or by calling our Egg Harbor Township food bank, and we can sort of tell you exactly where it goes at different times. So that's the mobile pantry, which is a choice pantry. I mean, it pulls up into different places, and it's, you can pick out produce as well and some protein as well as some shelf stable foods. So that is available to people in those counties down in South Jersey. The mobile SNAP unit is something that we use to go to places. It's really like two little mini offices that are in this van. It's very cool. And so we can go to places and actually work with people. Some of this is very confidential information. People don't want to be out in the public. And so we can bring people into the van, sit with them, work with them one-on-one, and really help them with that application, including uploading documents and just telling them how to follow up and how to get in touch with us if they don't hear back or need some help navigating the system. So that's some places we do SNAP outreach. They're equipped for us to come in and use an office or something, but places that don't have that, we do have that mobile unit as an option.
So right along the lines of SNAP, we actually got a question about nutrition education. So do you come to schools to provide nutritional education for families and children?
We do. We go to schools, we go to community centers, we go to all sorts of places to do nutrition education. And it's really wonderful because we can teach people not only which foods are healthiest, but how to make them maybe, align with your cultural interests or, just different spices or foods that people haven't tried before. I mean, sometimes the food that we get, especially from the federal government, we might get produce that is something that a community hasn't really seen before. We didn't in the beginning, there was a lot of kale coming in and not everybody was so into the kale. But we had some recipes that we worked with people and showed them how they could use it. I'm not going to say everyone became a kale lover, but I think people got, really understood that they could try a different food, use the spices they use that they enjoy or that their family enjoys, and find ways to incorporate those things. And there's always, we're very grateful for the food that we get from the federal government. We don't always know in advance exactly what it will be. But when it's fresh produce, that's wonderful. And so we just have to make sure that people understand how to use it and how to enjoy it.
So earlier on, you had talked about two populations, specifically college students, but also seniors. So I'd like to, we had a few questions actually about seniors. So what is CFB&J doing to ensure that seniors are getting good nutrition regularly to support, healthy aging, chronic diseases, things like that?
Yeah, so we work with a lot of partners with the CSFP program. So it's Commodity Supplemental Food Program for seniors. Many pantries do home delivery for seniors. Some for seniors who are able, they can come to pantries. Some of the mobile units are really great to go to senior centers. So we're working in all those places. On kind of a micro level, we're looking to do CSFP at our Garfield pantry. And start to look at that. And if we have, volunteers or resources, possibly some home deliveries. And then one pilot that we're about to start in South Jersey, which we're very excited about, is actually using DoorDash to do home deliveries. So finding ways, there's a place that's sort of existing people and an existing infrastructure that are used to kind of going to people's homes. We're thinking of using those to serve seniors because we know for a lot of people it is very hard for them to get to a pantry, or even if they can get there, then to carry food home. So really trying to find all different types of innovative solutions that we can use to get food directly to seniors. And then college students, we work with college pantries quite extensively. We have a volunteer group here called Women Fighting Hunger, who are these amazing group of volunteers. To call them volunteers doesn't even seem to do them justice because they do so much incredible work for us. But partly they've been working with the college pantries to help them develop different sort of ways of serving their communities. I know one of them has like food lockers, so people can order food online and leave it in a locker because college students don't have typical schedules necessarily. They might have night classes. They might not be able to come to the pantry during the hours. So finding different ways to reach those populations. And as I said, finding out what specific foods are helpful for them. If they do live in a dorm or in a place without a kitchen, that's a very different needs that they may have than a family living in a place where they have a full kitchen. So really just working with those two populations to kind of try to figure out the best solutions for them.
So actually just now you briefly touched on volunteers. I know you specifically mentioned Women Fighting Hunger, but we have a question here. Are you looking for more volunteers from the community?
Always. That's the quick answer. Yes. I mean, we could not do what we do without our volunteers. We had almost 90,000 volunteer hours at the Community Food Bank last year. That's incredible. People come to Hillside to volunteer, but also to our pantry in Garfield and to our food bank in Egg Harbor Township. And the work that people do can vary dramatically. So, and at our mobile unit, I should say, our mobile pantry. So sometimes there you'd be serving neighbors directly if you're working at one of the pantries. At the food bank, you could be scooping pasta. We get huge donations of, enormous boxes of pasta. It has to be put into much smaller bags. So people put things into the right size for families, as well as, sort donated food. So we often will get donations of food, but it could be a big variety of things that come in at once. And so it just needs to be sorted and repackaged. Also people who work in the kitchen. To help us prepare meals. We prepare meals for our child feeding programs. And so people come in and actually help in kitchen work. So there's really something for everyone. And we have volunteers who also work with us in an administrative capacity more. So we've had people, do projects for us in finance or help with, mailings or, all different kinds of things. So don't worry if you sort of don't know what skills you have or what the right match would be. If you go to our website, cfbnj.org, you'll see many ways that you can volunteer. And it really is a crucial part of what we do. The pantry in Garfield, I know it's, as I said, it just opened very recently, and there just has been such demand that they are definitely in need of volunteers, particularly if you happen to speak Spanish or Polish. But even if you're like me, only speak English, we still need hands there and really just are always looking for help.
Before we get to the next question, I just wanted to mention any questions that we do not get to. So please keep the questions coming. We will take in all the data, all the questions, and we'll get out the responses to you following the webinar. So you sort of touched on this a little bit when we were talking about our mobile pantries and when we had the map up on the screen. But we did get a question about the dynamic of supporting both North and South Jersey. So can you touch a little bit more on that?
Yeah, and it's been very interesting because obviously they are very different. I mean, some of the areas in South Jersey in particular, there's obviously urban down there also, Atlantic City, but there's much more rural areas. And so what we've seen there is just really needing to sort of work with partners, make sure we're spread out enough. We know that for some people to have to travel very long distances just does not make sense. So we have the Hillside warehouse, which is a very large one. We have a much smaller one in Egg Harbor Township. But there we do have the warehouse as well as the pantry, and then a whole network of partners down there as well. So I think the dynamic is, we've just made an effort to make sure that people at both sites kind of feel a part of the organization, understand that we're all sort of working towards the same thing, just often in slightly different ways. But I think there's more alike than there is different about the two places in terms of the work that we do. I think from it can be a little bit harder sometimes down there, to find people to work there, just because there's not as much of a dense population. So there are differences like that as an employer that we have to think about. But in terms of our partnerships, I would say it's very similar. I mean, we have child feeding programs, partner pantries, soup kitchens, all of those things in both regions.
So this is actually a pretty good segue to our next question. So we just talked a lot about partnerships. So with a question here asking, what type of strategic partnerships do you feel are maybe a gap or something that we need to advance our goals further?
Yeah, great question. And I think, I did touch on some of it, but I think even more of the things that we've talked about. So to me, like what we see so much, and when we talk to health professionals, just how much diet really matters for overall health. And so the more that we can partner with health organizations, we can, in Newark, we have a partnership, like somebody who might be on visiting their doctor, gets diagnosed with diabetes or with heart disease, can literally go upstairs in the same building, meet with a nutritionist, leave with food that makes sense for the diagnosis that they've just gotten. Because it's very overwhelming for people. I mean, when they hear they have a serious health issue and are told they have to make changes in their life, we all know how hard it is to make changes. I mean, for any of us, even in your diet, anything else. And so to have somebody right on site who can sort of walk you through that and then actually give you the food that you need for that day to be able to start making those changes is really just amazing. And so I think those partnerships, I think really with pantries that aren't part of our network, just because we're not sort of serving a certain pantry, we still would love to know what they're doing, what they're seeing, what trends there are, how we can work together. I think sometimes, one of our challenges when we are looking at gaps in the state or things is we know what we're distributing to people. We don't always know other sources that people may have for food. So I think the more that we work, there are county coalitions that have formed that are wonderful that we're part of, and we want to continue to work with other groups in those counties to just sort of say, like, what are the gaps and how can we all fill them together?
So changing gears a little bit here. And for this next question, if there is anybody interested in this program, please put your name and contact information into the chat and we'd be happy to get you more information about it. We have a question here about someone who is interested in the warehouse training program. How can we access vetted talent if and when we're hiring? And also more about the program as well.
Yeah, no, that would be amazing. Because so what happens is anybody who comes to this program is sort of learns different pieces of machinery and can find out sort of, they can get certified in using different pieces of equipment. So if you contact us, again, you could do it through our website, or we can probably give, if we know who that person is, if you want to give us your email address, we can certainly get in touch with you because we are always looking for job opportunities. We hire some people from our training programs internally, but there are many who we'd like to place in jobs. So we could even, and if you are one of our partners or know us, if you want to come and see it, learn about our curriculum, you'd sort of have an understanding of what somebody has been trained in and what their certifications are before they come and work there. But absolutely, we would love it if people could come to from us to our partners and work there. I think that would be wonderful. Because many of our graduates do, they get very connected here and want to work here and really believe in the mission also. Many of them grew up with food insecurity, and so want to be able to work in this. And so if it can't be here and it could be with one of our partners, that would be incredible.
Speaking of our partners, we have a question from one of our partners. So a question from one of your 800 partner agencies. What are your thoughts on the desirability of potential merger/consolidation of smaller food pantries under a larger umbrella, which would then be able to better provide both non-perishable foods plus more than food wraparound services to address the root causes of food insecurity?
One of our goals. So I love the question, and it's definitely the way that we're thinking also. And I think that can look different for different places. So, we have instances where we might have a large partner in a town, and then a church or someone serves, maybe a very specific population and wants to open a pantry. Well, it doesn't always make sense for someone to open another pantry if there's one, right down the street. And yet we understand that that might be the only place that certain, people will come if they're undocumented or if they're just comfortable there or have language barriers to other places. So what we've seen in some cases is the larger pantry can just, load up their vehicle, take it down, do a food distribution at the church in that example. So that's kind of a very loose but beneficial partnership. But I think if there were, places that wanted to merge or even just larger partners who, from our efficiency perspective, again, delivering to 800 partners, probably not, the best way for us to make sure that we're having a very efficient delivery system. So it could be that we look at more of a hub and spoke model over time, that we're bringing things to one of the larger partners, helping them with what they need. Like I said, a loading dock or refrigeration, and then having the smaller partners kind of get their resources from there. Very preliminary in that looking at things, but I think it is definitely the direction that we would want to head. I think it, makes us more efficient, and anything that we can save in efficiency is to give to is to be able to pass to the network. So we really want a strong, efficient network overall, because we think there are probably better ways to get food to the people who need it than what we have right now.
So we have another question, semi-partner specific. So is there a written resource on our direction that will be shared with partners, for example, a top level strategic plan that is shared annually? So maybe something like this.
Yeah, we have. So we didn't initially share the strategic plan, but I think, sending out an update to our partners is a great idea. And even when I do the countywide meetings, I can go through some of that with people. So if you are one of our partners who comes to those meetings, great, but we can absolutely send something out. I think that's a really wonderful idea. And I know, I've been asked, a number of our partners are doing strategic planning of their own. And I've sort of been asked to, talk to whoever's helping them with their strategic plan on our direction so that people can work with us on that. And we're all kind of working towards those same goals. And I'm always happy to do that. If pantries are, we've had people who are thinking of making changes and kind of want to come to us and say, anything we should know that you're going to be doing differently so that we know what to do differently. That's always a conversation that we're willing to have, whether it's with me or with your network relations person, really anyone here who can be helpful in your own planning. We want to do that as much as possible. We've been very fortunate in the amount of donations that we get and the amount of government support that we get. Again, I'm hoping that doesn't change anytime in the near future, but we all know that those things can change over time. And so want to be prepared for that and make sure that, we're all working together with finite resources to serve as many people as possible.
So changing direction just a little bit, going back to one of the last things you had said when you were presenting the strategic plan. So this is regarding data governance. So a CRM database was briefly mentioned regarding data governance. Are there any specific short-term, long-term goals you aim to achieve through the utilization of your chosen platform?
In the short run, even before the CRM is fully up and running, we've been doing a lot more with our data internally. So as I mentioned, we now have, a software that is doing our routing better. We think we can do much better in terms of routing now that we do have, all the trucks are equipped with the software, and we know how long stops take. It can, change for fluctuations in traffic, things like that. So I think just our on-time delivery is something that we have seen improve and can continue to improve using data. But some of the longer term goals are, as I said, really to serve our network better so that anybody from the food bank who is coming to a network partner who knows knows what programs they have or might want to have. Some of our partners have, during the countywide meetings, I've heard from people like, well, I didn't know you had that program. Like, I'd be interested in doing that. We need to get better at sharing that. And so we need to have, internally a way that people sort of have the whole picture of any of our partners. So some of you have probably gotten calls sort of asking about, how do you have refrigeration? Do you have, loading docks? It's because we want to know if there's more that we could be doing with partners. So having kind of a better assessment. So that's really the early step in the CRM, is making sure that everything we're putting into it makes sense. As we all know, you need to have good inputs in order to have good outputs. So making sure that we have up-to-date information from all of our pantries. And then some of it, I think, is just having a better sense. The data that we use, even though I mentioned we probably have at least 30 different data sets, I think it's even more than that, but I didn't want to overstate. But it still isn't up to the minute. Sometimes some of it's very delayed. Data that we get from a federal government or Feeding America can be sometimes like 2 years delayed. And so we're really trying to figure out from the people on the ground, from people who are seeing neighbors every day, being able to get data that gives a truer picture of where food insecurity is and where it's changing. Again, we know in general where things are, but things change. People, populations change, people move, and we really want to have a better sense of that data. So hopefully there'll be somewhat of a two-way street between partners and us in terms of really being able to hone in on that and get really good, up-to-date information.
So I don't think I could let the rest of this webinar go by without asking you this question. So you have just surpassed your 1-year anniversary. So at CFB&J, July 2023. So what has surprised or inspired you most about the work during your first year?
Oh, that's a great question. So I guess it probably sounds cliched, but it's the people. Every partner that I've been to visit, just incredible people who are running our pantries, our soup kitchens, our child feeding programs, the people who work here, the staff, the volunteers, the donors. Like, it really is just amazing how passionate people are about this issue and how they really just see it as, a justice issue. Like, I think it's not the nice thing about it. I think it's fairly nonpartisan, right? Like, nobody thinks children should be hungry. And so I think seeing that shared passion and just people from all different backgrounds, many people who've experienced food insecurity themselves come work here or become volunteers or become donors. But also some people who, feel like they've had a very lucky and privileged life and so want to give something back. And so you really meet just about every kind of person here. And I think that's amazing. And as I said, every partner that I go to, I feel like I always learn something new. And most intriguingly, see how tuned in they are to their own community, so that it is not just sort of like, oh, you roll up and just start a food pantry. People really get embedded in their community, find out what the needs are, what languages are spoken there, what foods are preferred, what nutritional issues or health issues are particularly faced by that community. And so it's really been incredible to meet so many people that are kind of all working towards the same goal, and our elected officials and our government partners too. I think just seeing, how much they want to work with us to make things better also is just, we're very fortunate.
So kind of going further back to what you discussed earlier, our Growing Healthy Pantries initiative. So, and this might be anecdotal data. I just wanted to, or anecdotal things you may have heard from partners or other employees, but if we have a question here, can you touch on how it's going with the choice pantry versus pre-assigned boxes? So I don't know if you have any.
Yeah, it's a great question. And it's funny because, I think we all, choice is obviously what we think is, wonderful for communities, and so respectful, and plus cuts down on food waste because people are only taking what they really want. And yet then we hear from some neighbors like, I don't have time. And, it doesn't actually take that much time, but I understand, like, people, if they're working 2 jobs or are picking their kids up, some people would actually almost prefer to just come up and be able to pick up a box. So we're trying to figure that out, is what's the best way to meet, people where they are. We saw the same thing with our produce. We were thrilled that we had this produce delivery company that could bring people pre-done boxes, and they'd have like 4 different kinds of produce in them, sometimes more. Someone could just get a box of produce. But then some people who run choice pantries were like, you do realize that we just unpack all those boxes so that people can choose what they want. And so we're like, okay, well then maybe we need to have different solutions for them. So I think the choice pantries are going great. I mean, we in, I guess it's on last fall, I think is when our pantry down in Egg Harbor Township went back to being a choice pantry after COVID. Like a lot of places during COVID, made total sense, right? Like you just wanted someone to be able to pull up in their car. You could kind of put a box in the trunk. But now we are a choice pantry down there. And it's gone incredibly well. I mean, the feedback from neighbors is definitely very positive. There is definitely decreased food waste because people are not given things that their families just are not, do not want to eat. And it turns out it doesn't take that much longer as long as we manage it well and kind of keep the flow going. I think people's concerns about how backed up it would get once people get used to it. And some places do online ordering, which I think is very cool. Somebody can, before they even come to the pantry, can place an order for things that they want. So it is choice in that sense. But then when they get there, they have the experience of just being able to pick it up. So again, I think all different models for all different populations. And that's really what we want to be able to do, is serve people the way that they need to and want to be served.
Just as a reminder to everybody out there, so we still have a bunch of questions that we're not going to get to. I know we're approaching close to the top of the hour, so we probably have time for another 1 or 2 questions. But I just wanted to go back to probably some of the, just more broader overview questions. So you touched a little bit on food just now, different kinds of food boxes. So does the food bank purchase the food for distribution?
We do purchase some. We have food from a number of different sources. We do get food from the federal government, which again, over time, we've seen the quality just continue to go up. Much more, fresh produce, frozen proteins. I remember, I'll never forget one of my first visits to a pantry where someone told me about something called mechanically separated chicken, which I had no idea what that was, but I learned, and I understood why they were horrified. And so we no longer have mechanically separated chicken. And we really have just made sure that when we're getting food from the federal government, the quality has really been great. And so that's been wonderful. And we've actually gotten an increased amount in the last year, which is wonderful. But then we also do purchase food. So we have such buying power as compared to our pantry partners or individuals because we're buying in such bulk that we really do get much better prices than most people can get. And so between using some state funds, donated funds, we do purchase food that we then are distributing to the pantries. And then we also get huge amounts of donations. And that's, individuals having food drives, but also from grocery stores, different places. And often then we don't even have to bring the food into the building. Like I said, if we have a pantry partner that has a vehicle, can go to Stop and Shop or Trader Joe's or wherever and pick up the food themselves, it's great. It's fresher, it's better, it's more efficient. Food is getting onto the shelves and into neighbors' homes quicker. So our food comes from a huge variety of places. But yes, a fair amount of it is purchased.
I think we have time for one more question, and I'm seeing a lot of really wonderful things from our partners in here. So thank you all for that. But one person specifically mentioned and if you could maybe, I know that you mentioned it when you were talking about our distribution earlier in the program, but someone was asking about the scorecard, the one that we're sharing with partners. If you have a little bit more context on that, if you wanted to share a bit more detail, if you could.
Yeah, absolutely. It's sort of going through, as I said, we're adding partners each time. And so I think we'll be statewide by the fall though. So what you'll get is something that gives some data on us. So how well we're doing in terms of on-time deliveries. We have a few different areas, food variety, communication. So we're asking both them to rate us, give us feedback on how we're doing, but then also giving some self-reported data that we can send out to people so that they see how we're doing, so that we're holding ourselves accountable. Because if we're trying to get our on-time percentage up, we want you to be able to see that and if it's working. And what also helps us then is, again, if I'm the pantry that you're late to all the time, it doesn't help me that your total on-time percentage is getting better if it's still in pockets. But having that data helps us look, are there places, is it because certain communities, they're harder to get to, or they have more traffic at different times? Like, do we need to make changes in our routing to address that? So it's not just looking at how much are we on time across the board, but really starting to dig into, are there areas that are sort of harder for us to get that percentage of on-time delivery up? And then how do we address that? So it's not just reporting, it's also problem solving. But it's really valuable to us to be able to get that feedback from partners. And again, we want to do it in all different ways. So the survey is one thing, but we also do the countywide meetings. We also have the Partner Collaboration Council. So really just looking for different ways to make sure that we know, because we know there's always room for improvement. And, as I mentioned, anyone who's ever run an organization would tell you communication is always going to be kind of the number one thing. And so for us, that's true, again, both internally and externally, just making sure that big picture people feel communicated with, that they know where we're headed and what our goals are. But then small picture, like who do I call if my tuna doesn't show up? It's really from the very macro to the very micro that we just want to keep improving.
Wonderful. All right, we're almost at the top of the hour. So before we depart, I just wanted to ask you, Elizabeth, do you have any other parting thoughts you'd like to share before we wrap up?
Really just thank you. Again, it's been an incredible year. I've just seen such amazing things happen, and it's just such an incredible network of people to be part of. And so to every, donor, volunteer, staff person, partner, even official partners and non-official partners. So people who are working in, school programs with us and after school programs. It takes all of us, and it is, we have a saying here, it's going to take all of us to fight hunger. It's really true that we cannot solve hunger by any stretch by ourselves. And we think it is a statewide effort. And so everyone from government to other nonprofits to the general public, we're just thrilled to partner with all of you and just feel, incredibly fortunate to be in this position to be able to work with all of you. So thank you.
All right. I think that's all we have. Thank you so much.
Thanks for taking an hour with us today, everyone.
Been great.